Hello dear students, welcome back to the class. So today's topic of discussion is myasthenia gravis or the drugs used in myasthenia gravis. So let's dear students first know about what is myasthenia gravis. So myasthenia gravis is an autoimmune disorder which is affecting a huge population due to development of antibodies that are directed towards the nicotinic receptors at the muscle end plate. So thereby causing reduction in number of free nicotinic cholinereceptors to one-third of the normal or less, and thereby causing a structural damage to the neuromuscular junction. So myasthenia gravis is targeted towards the nicotinic muscular cholinereceptors causing neuromuscular junction and causing a structural damage. So this is a basic idea with which we can start with the topic. So at the above you can see that here this neuromuscular connection is getting destroyed where in myasthenia gravis. And here also you can see that ptosis or drooping of eyelids is taking place in case of myasthenia gravis. So let's quickly move on to the presentation to see what in details the myasthenia gravis is caused by, its pathophysiology, symptoms and everything. So this is the content slide comprising of myasthenia gravis, pathophysiology, causes of myasthenia gravis, symptoms, characteristics and the drugs used. So in this slide you can see that these are the contents, and with this content I have put a picture which is depicting that the receptors are blocked by autoantibodies, and here you can see acetylcholine is present, and this is the neuromuscular junction, and this is binding to the nicotinic acetylcholine receptors. So what happens, there is an increase of muscle use or repetitive muscle use that causes increased weakness and fatigue, means muscular dysfunction, neuromuscular structural damage. And here are the acute myasthenic crisis which is occurred or triggered by infection, medication, respiratory failure, mechanical ventilation and the plasma exchange process. So this way you all can understand that how this myasthenia gravis is acting. The main heads point are that it is acting on the nicotinic receptors. Second, it is causing neuromuscular dysfunction due to the repetitive use of the muscles. So now coming to the details that what is myasthenia gravis. Myasthenia gravis is an autoimmune disorder which is affecting the neuromuscular connection, as you all know by this time, is characterized by varying degrees of weakness of the voluntary muscles. The causes problems with the nerves that communicate with muscles, affects the voluntary muscles of the body, especially the eyes, mouth, throat and limbs. So here the takeaway point is, dear students, it causes neuromuscular dysfunction or neuromuscular functional structural change, and it causes weakness of the voluntary muscles. What are the muscles? Especially in eyes, throat, mouth and limbs. And here is a diagram provided. Here you can see the normal nerve transmission is taking place. Acetylcholine is released and accepted by the acetylcholine receptor in the muscle cell or the postsynaptic cell. But in myasthenia gravis, what is happening? This acetylcholine on releasing, it is not binding to the receptor and causing a neuromuscular dysfunction. Similarly, here let's once again go through this, that it is one less common autoimmune disorders. It is an autoimmune muscular disease leading to fluctuating muscle weakness and fatigue. So neuromuscular, autoimmune, these are the key words. When you are writing myasthenia gravis, you should have these words: autoimmune, neuromuscular dysfunction, voluntary muscles, nicotinic receptors. Now let's quickly see the pathophysiology. Acetylcholine receptor antibodies blocks the normal binding of acetylcholine and subsequent the muscle activation. So in addition, what happens? It also activates the complement which damages the end plate, and thereby the number of acetylcholine receptor declines as the disease progresses, and thereby causing a neuromuscular dysfunction or the structural change at the neuromuscular connection. So this way the myasthenia gravis definition, its pathophysiology, along with its functioning with respect to a normal neuromuscular transmission is being established or illustrated, you can say. Next is the causes of myasthenia gravis. So it is an autoimmune disorder. It is congenital, that is present at birth. In rare cases, mother will pass antibodies that cause the disease onto the child. However, this is a curable in the child. Abnormal enlargement or tumor of thymus gland is associated with myasthenia gravis and might trigger the production of antibodies which cause the condition. So here, dear students, you can see that all these terms we are using again and again, that is autoimmune, congenital, then it will pass on, maybe pass on from the mother to the fetus. But a key point here is only in case of child it can be recovered. When it comes to adult, it cannot be recovered. It is not a curable disease. Next here, let's see the causes. That is, it is a neuromuscular disorder. Autoimmune disorders occur when the immune system mainly or mistakenly attacks the healthy tissues. In this condition, the antibodies, that is the proteins which normally attack the foreign harmful substances in the body, attack the neurotransmitter substance called the acetylcholine, which is a crucial substance for nerve cell and muscle cell communication. So it is attacking the neurotransmitter, which are the communicator, or you can say which are the bridging cell of the nerve cell and the muscle for its communication. And this ultimately results in the muscle weakness that characterizes the condition. An exact cause of the autoimmune reaction is even unclear to doctors because it is an autoimmune disorder. We don't know still now that how the cure or how the complete treatment can be done. Okay. Next is the symptoms. Here the symptoms that I just quickly will go through this picture only. This you can all read from the slide. That is, it causes drooping of the eyelids. It causes double or blurred vision. This in case of ocular muscles or in eyes. In the face muscles, it causes limited facial expression. In the throat muscle, it causes difficult to swallow. That is a dysphagia and slurred speech. This is also caused, and the limb muscles causes weakness in neck, arm, fingers and legs. So as I said earlier that it is causing the trouble or difficulty in case of voluntary muscles, abnormalities in case of voluntary muscles. So I have shown that what are the symptoms which are occurring in the specific areas, that is eyes, mouth, throat and the limb. So these are the basic characteristics of myasthenia gravis that can be observed. That is, it leads to weakness of skeletal muscles. Lab test or imaging is required. Treatment can help to manage condition but not cure offered. Can last several years to be lifelong, and the muscle weakness occurs due to breakdown of communication signals between the nerves and muscles. Again, the symptoms have been discussed, and the factors that can worsen the myasthenia gravis is fatigue, illness, stress, extreme heat, some kind of medications even such as the beta blockers, calcium channel blockers, quinine and some antibiotics. So these are the basic characteristics, dear students. You can also write upon if you're asked a question that write a short note on myasthenia gravis. So you can incorporate such points to make your answer more clear and distinct. So now coming to the main part, that is the drugs used in myasthenia gravis or the treatment procedure. It comprises of immunosuppressants, cholinesterase inhibitors, corticosteroids and various medical procedures. For immunosuppressants, what does they do? They cause the abnormal immune response can be minimized. They minimizes the abnormal immune response. So they regularize the immune system of the body. The drugs used are prednisolone, triamcinolone and methylprednisolone. So prednisolone is a main group of drug that is used, you all should remember. Next is the cholinesterase inhibitors that helps in improving the signals between the cell, that is a pyridostigmine, and the corticosteroid. These types of drugs inhibit the immune system, limiting the antibody production, and the prolonged use of corticosteroids can lead to serious side effects. So this drug is used rare, but still you can use because it has got a number of side effects. And lastly is the medical procedure, that is the thymectomy can be done and the plasma exchange. So the main drugs that you can use for myasthenia gravis is prednisolone and pyridostigmine. So these are the main drugs. So for these two drugs, you have to go through the detailed mechanism of action, dear students. So thank you students for listening to this presentation. Myasthenia gravis is very small topic. The main topic was the drugs used. You need to remember and recall all the drugs used for myasthenia gravis. And prior to that, for writing a short note on myasthenia gravis, you need to know the detail. That is, what is myasthenia gravis, its pathophysiology, its cause, symptoms, and various characteristics. That's why I have discussed elaborately in this presentation. For any doubts and queries, feel free to ask. And once again, do your assignments on time, and hope this presentation will help you all in doing this assignment. Thank you once again.